To another major story tonight, and for Canadians living with multiple sclerosis, more disappointing news about a treatment for which so many have such high hopes. Authors of a new study say their evidence simply doesn't support it. Health reporter Kelly Crow explains.
Michael Augustine has multiple sclerosis. He knows all about the theory linking narrowed neck veins with MS, and he knows people who've paid thousands of dollars to have their veins surgically widened, but he decided to wait.
What I've learned now is that hesitation is not always a bad thing because it permits you to really analyze what you're looking at.
It was a radical theory proposed by an Italian doctor almost 4 years ago. Once it hit the media, Canadian MS patients rushed to foreign clinics, risking potentially dangerous side effects, even though the theory had never been scientifically confirmed. Meanwhile, scientists around the world have been trying to reproduce the original findings, and so far no one has been able to do it.
Well, our study does not support this theory, and we're not the first.
A McMaster University paper published today failed to find a difference between MS patients and healthy controls, calling the findings compelling evidence against the theory.
We could not find, using either ultrasound or MRI, any evidence of stenosis, narrowed veins, or blocked veins, which would be consistent with the hypothesis.
It could be the act of taking the ultrasound that causes the veins to appear to collapse. Researchers also say it's possible that what they're seeing is not a disease, just normal variations in vein structure. It's a scientific inquiry that has been fueled by protests and politics as MS patients lobbied governments to take the theory seriously. Saskatchewan's premier announced he would sponsor a clinical trial. So did the federal health minister. MS expert Dr. Jock Murray says it's a case of politics setting the scientific agenda.
If it were left to the scientists, the studies wouldn't have been done in the first place, because there was never any substantial belief that this was a reasonable approach.
But this Vancouver researcher is not abandoning the theory. He used a different technique to look for blocked veins, and his results will be published soon. He's also running that federally funded clinical trial, testing the procedure on MS patients. Those results won't be published for several years, and he advises patients to wait for the science.
The only way to truly address whether or not this is worthwhile is to do a proper research study, and the Canadian study that's underway now will address that.
Michael Augustine says he understands why some have rushed to get the procedure, but he says he will continue to wait. Kelly Crow, CBC News, Toronto.